Hey everyone, Dr. Sylvestre here. Today I'm going to tell you what to look for if you are trying to pick a hands-on TPLO course. Understand that what I'm saying applies to most hands-on surgical courses, but I just want to focus on maybe a procedure that's a little bit more difficult as well. So the TPLO I would consider to be a more challenging procedure than an extracapsular repair or an FHO or something like that. So when picking a TPLO course, make sure that that's the only thing they're teaching. You're going to have enough to learn with just the TPLO. For a course on a TPLO, you definitely are going to want a course that is more than 1 day. It's going to take you more than 1 day and one practice session to get even a little bit comfortable with the TPLO. You want to have a reasonable instructor to student ratio. So I myself, when I give a hands-on workshop, my maximum is 8 students per one of me. Now, if I was doing a TPLO workshop, I would make sure that the students, the veterinarians, work in pairs, so I would only have 4 stations to go to. The more often I get to each station, the more I'm going to pick up mistakes, the more questions I'm going to answer, the more intricate details I can show and demonstrate, because I'm going to get there at the most opportune moments. So 4 stations per one of me would be my max. They might have one instructor who's speaking, but several helping, so that will allow for clearly more stations and more students. Sometimes veterinarians, no, that's not true. Oftentimes, we veterinarians are under the impression that we're going to learn the procedure better if we get to do it all by ourselves, because you're going to do every single step of the procedure. I have found from giving hands-on workshops for years and from always trying to allow the students to work alone, I have found that we actually tend to learn better when we are working with somebody else. Now, of course, it means you have to get along with that partner, but that's not usually a big problem. You learn so much more by seeing what somebody else does. Sometimes you become a bit of the teacher. Sometimes you become more of a student because your partner's more experienced. In all cases, you're going to see the instructor more often, but you are going to learn a lot more from talking and seeing what someone else is doing. So don't be afraid of workshops that pair you up. Oh, and if there are more instructors, there's more of you, and there's, maybe the one head instructor and other instructors, you want to make sure that the other instructors are also equally qualified. I know way back when I was doing my internship and residency, we would offer workshops to veterinarian. The full-fledged professors would be offering workshops, and we were often called in to help in the workshops. Couldn't answer a lot of questions when I was an intern. I wasn't really helpful, so I don't consider someone that's an intern or a young resident as a qualified instructor. Doesn't mean you're not going to learn from them, but you may not be learning what you need to be learning in that workshop. They need to be using cadavers, not just sawbones. Fresh frozen cadavers are way better than the preserved cadavers because you see the layers better, which is important. There's pros and cons to everything. Clearly, it'd be lovely if we could just do it all on real dogs, but I have a bit of an ethical concern with that, so let's not even go there. And you want to be able to do the procedure more than once. So in other words, if you watch a video, do it on a sawbone, and then go get to do it once, for a TPLO course, I'm going to tell you that's not enough. The first time you do the procedure, it is just a messy blunder. That's all there is to it. And I know that. And it's important to often tell the participants that, don't worry, the first one's going to be awful. but you kind of feel your way around, and then you do it a second time, and yeah, it makes a little more sense. The third time for some of these simpler procedures is kind of the clincher. And when I did my extra cap hands-on workshop, we always did it 4 times. By the 4th time, and I know it's on a cadaver and it's not the same as doing it on a real patient, but at least you could just see the participants, the veterinarians that were there to learn, their hands were flowing, they were more confident, their incisions were more precise, where they had to place instruments was more precise. Just a huge difference. So if the workshop you're taking offers 1 cadaver for a TPLO workshop, it's probably not enough. It's really good if you could do the surgery more than once, and with a partner. Ideally, with the TPLO workshop, you have the ability to take post-operative, even if on a cadaver, but your post-operative radiographs, because reading those post-ops is a really important part of the surgery. And being able to position the animal and to take good radiographs. So that would be ideal, and I know that might be the most difficult criteria. To me, that would not be a deal breaker if you can't take post-op radiographs, but it is a bonus if you can. Let me just say it that way. Clearly, it's really important that at the workshop, discussions on how to deal with the patient post-operatively, and I mean for the extended post-op period, at least the first 8 to 12 weeks post-op, is hugely important. What you expect to see, how often you should see the patient, what you should expect to see with the different visits, and how you're going to help your patient move on to the next step. So that is hugely important, as well as case selection. Number 1 criteria, just because you now know you've learned how to do a new surgery doesn't mean you should go out there and do it on every patient. Some just naturally carry a poor prognosis, are just more difficult. Don't start there. I'm not saying never do those ones. I'm saying don't start there. Start with a nice little 30-kilo Labrador or something like that. Leave the bulldog that has crooked legs. Leave the 200-pound Mastiff for somebody else to do. One other thing I need to tell you about. You're going to get a lot more out of your TPLO workshop if you already know how to use a drill, how to select screws, how to insert screws, how to bend a plate, and how to assess fracture healing. So ideally, you take a basic fracture repair course before you take a TPLO course. You can't do a TPLO without knowing how to do these things. Now, they may teach you that in the TPLO course, but remember, the more things you need to learn in those 2 or 3 days of your TPLO course, the more things you're going to forget, right? I mean, we can only fit so many things in our brain. So I find if you can have the basics there and then allow yourself to build on top of that, how to do the TPLO, post-op care, talk about case selection, complications that can develop with the TPLO surgery. Now, having said how to select a course, when you come home, just because you went and took the course doesn't mean you're ready to go do a TPLO. There's a few things you need to do. 1, you need to make sure you review the notes and review the videos. Oh yeah, did I forget to say you've got to be able to go home with a video on how to do the procedure, because you're going to watch that video over and over and over and over again before every single TPLO, just to help get your brain, your body prepped for what it needs to do and not to miss any steps, right? So you need to go home with a video. When you get home, you're going to reread your notes, you're going to watch the video, and you're going to get yourself some cadavers and practice the surgery. Take the post-op radiograph. And the TPLO surgery is team work. So you're going to need to have your technician there ready to help you and to help you think, what's the next step? How are we doing this? How are we going to set up the dog? How are we going to set up the OR? All that needs to be worked out. In a perfect world, I get that's not the world we live in, but let's pretend. In a perfect world, you would go back after doing several cadavers and take the TPLO course again. It could be the same course or a totally different outfit giving the course, but go and repeat that course. You'd be amazed how much more you're going to learn the second time around. Wow. And don't wait too long for the TPLO, and again, especially if this is new to you, this is not something that you've been working with a mentor, another surgeon. Taking the course a second time will make a big difference. Once you've taken the course a second time, in a perfect world, you're going to practice again on a few cadavers, and now you're going to see how much quicker, how much better, and how much more precise and confident you are. Now you're ready to offer it to your clients.